Hi Posture Nation Elite, it's Dr. Mark here at the American Posture Institute. Today we're going to go through one of our functional taping protocols looking specifically at a muscle spasm. So we believe at the American Posture Institute that all of your therapies should be an objective, clinically reproducible therapy that you can determine with a pre and post test if it's valid and if it's effective or not. This prevents you from being one of those YouTube tapers, specifically when we're talking about functional tape. We see this all the time. You go on to YouTube, you see how to tape a knee or an ankle, you go try it, you get minimal results, so you get frustrated with the taping protocol or with the taping, and you just stop it. However, functional taping can be an extremely beneficial therapy to add into your tool belt. So let's look at this specific patient that comes in with lower neck pain. So we're going to go through the American Posture Institute's taping protocol. The first question that you need to ask yourselves, is it hypermobile or unstable? If it is hypermobile or unstable, we're going to go through a different route with supportive taping. However, in this instance, we're going to declare that it's not hypermobile. We would have checked it for hypermobility, and we're determining that it's not. The next question in the protocol, the taping protocol, is there pain? So obviously the patient's coming in with neck pain, so we do know there is pain. If there was not pain, we would go down a different route of the protocol, checking for dysfunction to determine proprioceptive taping or postural distortion patterns. So in this instance, the patient is presenting with lower neck pain. So now we need to determine, is it acute or is it chronic? If it was chronic, we're going to be looking at some SPRT taping or potentially high tension taping. In this instance, we're going to say it is somewhat acute. The lower neck pain has started relatively recently. So now we need to determine, is there edema in this? Is this an injury that has edema? In this instance, we're going to say no. However, if there was edema, we would want to do edema reduction taping. This instance, it's just simple low neck pain. So upper trap, low neck. So the next thing we want to do is spasmodic taping. So we're going to apply this spasmodic taping by doing a tissue pull. We're going to have the patient do pre-tissue stretching or tensioning by elongating the tissue. And you'll be able to see this in the picture behind me here. And then we're going to apply this taping with inhibition taping, so negative tape tension. So we apply this down to the lower part of the neck, the upper trap, and then the post test is to ask the patient if they feel relief. The patient should feel immediate relief. It doesn't necessarily mean that the pain or the spasm has gone completely away immediately, but they should immediately feel a change. So you ask your patient, how do you feel? They should say, oh, that feels better. That is a positive for using muscle spasm taping technique in this specific situation. If they did not feel relief and there was no change, then you would not be using this taping. So that's how you can use a specific taping protocol in a taping flow chart to know specifically and objectively what type of taping technique and what type of tape tension to use on this specific case presentation with a patient with lower neck or upper back pain. Now, if you want more information specifically on how to do muscle spasm taping or the rest of the American Posture Institute's functional taping protocol, go to the American Posture Institute at americanpostureinstitute.com.